Good morning, everyone. My name is Allison Guarino, and with my colleague Justine Egan, we will be coming to you from the Massachusetts Department of Public Health to present on how to use data effectively. Before we begin, we wanted to explicitly mention the role of systemic racism at the core of current events going on in our country right now, particularly in Wisconsin. We recognize that this is a painful moment, even more so for Black people and other people of color. And we wanted to acknowledge that while we will be talking about effective data use and reproductive health and adolescent health, that this is at the forefront of people's minds. So with that, like I said, we're coming from the Massachusetts Department of Public Health, specifically the Office of Sexual Health and Youth Development. So the Office of Sexual Health and Youth Development is comprised of multiple programs that work synergistically to increase access to comprehensive sexuality education, to decrease teen and unplanned pregnancy, to decrease the incidence of sexually transmitted infections, to increase the sustainability of delivery networks serving youth and other vulnerable populations, and to increase protective factors for young people using a positive youth development lens. To your right, you'll see this flower diagram of our office's values, and you'll see that racial justice is the central value that guides our work. Our programs are situated along a continuum using the life course approach, starting with young adolescents. We have positive youth development programs such as our sexual risk avoidance education program and our LEAD internship program. We also offer comprehensive medically accurate sex education through our personal responsibility education program and our adolescent sexuality education program. We offer support for pregnant and parenting teens, and then we also offer clinical sexual reproductive health services for all genders and all ages. So a little bit about us. Again, my name is Allison Guarino. I am an epidemiologist at the Massachusetts Department of Public Health. I use the SHE series, and I work to support the data and evaluation needs of our education programs as well as our clinical sexual and reproductive health programs. And I'll pass it off to my colleague, Justine.
Sorry, I was muted. Hi again, everyone. My name is Justine Egan. I am an epidemiologist, also at the Massachusetts Department of Public Health. I work in the Office of Sexual Health and Youth Development along with Allison. And I work primarily with comprehensive sexuality education programs and pregnant and parenting teen initiatives. And together, Allison and I both handle surveillance for our office around sexual and reproductive health and also program evaluation. And so I am sharing my screen right now. So everything that you can see is what is on my screen. So that's a little bit about us. I would like to get to hear a little bit about all of you. So if you could in the chat introduce yourself, just your name, the organization or the agency you work at, and what your role is. And because you are all seeing my screen, I'm going to open up the chat so that I can see this. So you'll all kind of see the chat, if I can find it. There we go. Oops. Well, I can't see the chat. Hopefully you are all seeing all of you and in your chat and where you're all from and where you work and what your role is. So I'm going to talk a little bit about what our learning objectives for today are. Our objectives for the next hour or so are to explore effective strategies for disseminating adolescent health data, discuss how data can be used to generate interest in programming, and examine how program data can be used for quality improvement and evaluation. To reach these objectives, here's a little overview of what we will be covering. First, I will start with an example of effective data use. So I'm going to go through a few slides about one of our programs at the Massachusetts Department of Public Health. The slides use data from surveillance, from our programs, and from other sources, like our program participants. Then we'll have a discussion about what kind of data do we need to create a similar presentation and what kind of data do you have available. We'll talk about generating interest and creating a message using your data. And then Allison will run through some best practices and tips for sharing data. And we'll end with quality improvement and how you can make sure you have the highest quality data to share. So I'm going to jump right into an example. So this is a presentation, it's a few slides about young parents in Massachusetts, and it uses data from a number of sources, and we'll talk about that a little bit more after I get through the presentation. So when we're thinking about young parents, again, this is very Massachusetts specific, that's the state that we're in. But when we're thinking about young parents and their needs, and particularly in our state, but also nationally, young women in foster care are more than twice as likely to become pregnant by age 19. In addition, 44% of 18 to 25-year-old females and 18% of 18 to 25-year-old males experiencing homelessness nationally are parents. So we know that young parents between the ages of 18 and 25, they're disproportionately young people who have been in foster care, and they're disproportionately facing housing insecurity. In addition, in Massachusetts, there are significant inequities in the teen birth rate by race, ethnicity, and community. So this graph is showing the teen birth rate in Massachusetts and in our two biggest cities, Boston and Springfield. As you can see, there are huge inequities in women aged 15 to 19 giving birth in the state. The Hispanic teen birth rate in Massachusetts is 8 times higher than the white non-Hispanic rate. When you look at Boston, which is the biggest city, there is a very disproportionate inequity. The Hispanic teen birth rate is 44 times higher than the white non-Hispanic teen birth rate in Boston. So given all of this, it shouldn't be a huge surprise that mothers aged 15 to 19 in Massachusetts are 25% less likely to receive adequate prenatal care when many of them are already facing histories of trauma or barriers due to racism, homelessness, being in foster care, and other trauma that's associated with all of those factors. In addition, adolescent mothers in the state of Massachusetts are more likely to feel depressed compared to mothers between the ages of 30 and 39. However, parenting teens want to create a better future for their child. This is a quote from a focus group done with young parents in Massachusetts. "My son motivates me to keep trying and striving to do my best." To address some of these needs, we have a program called the Massachusetts Pregnant and Parenting Teen Initiative. This is a case management program. It uses a strength-based two-generational approach, which means the case managers work with both the parents and their children to increase life opportunities and enhance family stability among young families in priority communities. The program serves pregnant and parenting youth between the ages of 14 to 24 in 5 high-need communities in the state. The program offers individualized case management and linkages to community services. The program also creates a strong community referral network so that young families in these communities can go through open doors in agencies throughout the community. And the program utilizes a data-driven approach that incorporates young parents' voices, and young parents help guide programming. Right now, I'm gonna show you a video. This is a digital story. It was created by one of our participants, and it gives you a sense of the needs of some of the young parents in our program and their experiences in the program. If anyone, when I start playing this, if you can't hear it, please let me know.
I'm 19 years old. I'm from El Salvador. I was only 10 years old when I came to the United States of America. And for the first year, I lived with my father because my parents are divorced. Everything changed after a year when I moved with my mom, stepdad, and little brother. While my mom worked, my stepdad abused and took advantage of me. I went into depression and started doing badly in school. This made my mother angry, and she physically disciplined me often. But I never told my mom the reason my grades were bad because I thought she would never understand or believe me. I separated myself in my room frequently. All I felt was unhappy and sad. Until one day I decided to take a bottle of pills. That day I ended up in the hospital and DCF got involved. I didn't want to live at home anymore. I was taken away from my mother and placed into a foster home with a Dominican foster mom. When I was 14 years old, I became pregnant by my boyfriend and had my first daughter, Chrisia. That's when we moved to a group home for young mothers and things fell apart again. At the group home, I got into a strong physical fight with another inmate, resulting in my daughter being taken away and I was placed into another foster home. Depression hit me again harder. I stopped caring about everything, including school. I was so alone and unhappy, with no one by my side. The only thing that would give me some hope was the one DCF visit I will have with my daughter. As time passed, she was adopted and I couldn't fight for her because I had no one to help me with her. When I turned 18, I became pregnant again and I had another girl. Her name is Hazel. I'm now a single mother of an 8-month-old Blessing, who has given me courage to keep moving forward. Moving from one foster home to another kept me from finishing high school and reaching my goals to become a pharmacy technician. I'm doing everything I can to get my GED with the help of ROCA and finally be successful. My biggest accomplishment is to give Hazel and her unborn sister everything I couldn't have and a happy and a good life.
Thank you everyone for your attention to the video. I know that it can be, it's a very emotional video, so please take a minute to take care of yourself if you need to. The last slide I'm going to talk about here before we kind of have some time for discussion is the impact of our program. So the Massachusetts Pregnant and Parenting Teen Initiative, MPPTI, serves 580 individuals annually. This includes young parents and their children. Among participants engaged in the program for 6 months or more, 98% of participants were enrolled in insurance, 58% made progress toward academic or career goals, and 18% of participants who entered the program with a high school diploma or equivalent were later enrolled in a post-secondary program. In addition, there was a 4% increase in participants with stable housing. The 4% may not sound particularly high, but given how difficult it is to obtain and maintain housing for 6 months or more, particularly in our state, the increase is significant. This is a quote from one of our participants. Every time I talk to them, even if I hit that patch where I get sad or don't get motivated about anything, as soon as my caseworker calls me to check in or schedule our next visit, I get motivated again. So participants feel particularly motivated by this program and that they have good relationships with their caseworkers. Among participants in the program for 6 months or more, full-time employment doubled and any type of employment also increased. The use of a contraception method among non-pregnant participants increased by 20% among participants enrolled in the program for 3 months or more. And finally, participants in our program expressed overall great satisfaction with the program. Here's another quote: "I wish all the young mothers in this whole country, in the whole world, could have this program." So that's the end of the our kind of example or sample of using data effectively. To create that presentation, there were a number of data sources that I drew upon. One is surveillance data. This includes birth data, survey data, so the data that included homeless rates, youth in foster care, and experiences of postpartum depression. All of that is survey data. The data on births and prenatal care is from birth data. So all of this is from separate data sets. I didn't actually include peer-reviewed studies, but that's another data source that can be drawn on for a presentation like this. Qualitative data, so focus group interviews or key informant interviews, as well as the youth-led story and the youth-led data. Having qualitative data woven into any type of data use is really effective in drawing an audience in. So a lot of people's eyes will glaze over if you just start spouting a lot of statistics, but if you're able to weave in quotes, videos, photographs, things like that, that bring a more human side to the story, it's able to draw the audience in a little bit better. And finally, program data, program reach, services delivered, program outcomes. So this is, all of that data was used and took a long time to collect, compile, analyze, kind of put together for a presentation that lasted about 10 minutes, including, you know, a 3 or 4 minute video. So what we want to do now is have some time to have all of you reflect on what do you need to analyze and present data. So I am going to open up a Jamboard and I'll explain what that is and how you use it for those of you who haven't used it before. So there should be a link to the Jamboard in the chat. And what you should do is click on that link and I will open up the Jamboard. So this is the Jamboard. This is how it looks. We have 5 screens here. Each of the 5 screens has a different question. We'll go in order. And so what we would like to do is answer these questions with sticky notes so that you all can participate. So the first question, what data do you currently collect for your programs? To join in and kind of start the discussion here, what you'll do is click on this kind of, it does look like a sticky note, I guess, this sticky note here, and then it will open this box for you and you'll type in your answer. So like our program collects, someone's already typing in here, you know, whatever you want, you click on save and then it will pop up here. And then if you want to add more, you keep adding more, otherwise you can cancel. And I'm going to delete my little nonsense here. So I will give everyone about 30 seconds to a minute to start to populate this Jamboard. And then we'll read through some of the answers and see if we have any discussion either in the chat or if people can unmute and want to say anything. While you're all doing that, I'm going to attempt to open the chat.
These are some great examples that are coming in. They can be specific questions that you already ask, like on a survey or in something you're already using to collect data, or they can be how you collect data, like using surveys.
So while people are continuing to add into the Jamboard, I will read out loud some of this. So types and rates of STIs, number of clients who seek birth control and what types they start, number of clients to seek services at our clinic, survey data, qualitative data, program data, youth pre and post test, exit and entry surveys, attendance outcomes, self-efficacy, health behaviors. So youth increase in knowledge, increase in confidence, intended behavior change, again, pre and post surveys. I saw in the chat that there are some PrEP facilitators, and we also have PrEP funding in our state. So we are a little bit familiar, or rather Allison is very familiar with the data collected in those pre and post surveys for PrEP in particular. Data through surveys, YRBS, state data, youth input on programming, and then a data sheet that starts at the beginning of a client's visit and is completed when all test results are in. So all of you collect a lot of data, and it varies from things like YRBS and kind of more statewide data to just youth input on programming and services, which is more case specific to the youth. And then we'll move. Does anyone have a comment or anything that they want to mention about this particular question? From what I can see of the chat, I don't see anything. So we'll move on to the next screen here. And then, so this question is, what can you use this data for? And so for those of you collecting pre and post data for some of your programs, we know this is used for federal reporting and other types of reporting, but what other types of, what else can you use the data that you have for besides federal reporting or things like that? Or how else are you currently using this data? And I'll give you all another minute or so to kind of populate this one. And if you can't figure out how to get to it, it's these arrows here. So you can move back and forth. You'll have to move back and forth on your screen also to get to it. So just click on the next frame to get to 2 out of 5. So I'm seeing a lot of things that we also use data for, a lot of program improvement, quality improvement, grants, advocating for more staff or demonstrating need, program successes, changed health behaviors, so rationale to implement PrEP, so similar is advocating or demonstrating need, informing key stakeholders, advocating for expanded services or based on increasing rates of visits and birth control access, annual reports, things like that. Is there anything that anyone wants to add here? So it looks like there's identifying areas where services are lacking and try to fill those needs. Okay, so we have a couple more questions in the Jamboard. I will turn it over to Allison to discuss the next few screens.
Thanks, Justine. The only thing I'd add is try not to modify the existing sticky note here that has the question so folks can be able to revisit it, and to go to the side and create your new sticky note to put around this one. But this next question that we want to ask is, what resources or capacity would you need to use this data effectively? It might be you need more staff and more time. It might be that you would need the time to create a new data collection tool. Try to think like really big here. We'll give it about another minute like Justine had for the other ones.
You can also include, I see someone put staff with data expertise, but if there's something very specific, like a certain software program or something like that, that's something to also think about in terms of resources and capacity. More time, I agree. I could always use more time.
We're seeing training, staff with data expertise, how to use this data to communicate with stakeholders, access to similar data from other clinics or local data that we could use to leverage what we want to do. That's a big one. I think it's hard because there are times when data is already being collected and you don't want to have to reinvent the wheel almost, but the ability to share data and communicate with other stakeholders or other folks doing this work is really helpful. So anybody else who wants to add a sticky or two? Just so you know, we are going to try and offer solutions toward the end. So don't feel like this is just an activity and brainstorming. But thank you for your responses. Training for orgs to use the data, how to disseminate the data, learn how to make federal survey data relevant to local stakeholders. Excellent response. A collaborative partner, another great one. Anything else? Anything in the chat, Justine?
As far as I can see, I don't see anything in the chat.
Okay. We want to move on to the next one.
That sounds great. Oh, sorry. There we go.
Okay. Now, what additional data would you like to collect and what would you use that for? So maybe thinking outside of the federal performance measures or what you have to do to meet grant goals. In a perfect world, what else would you want to collect and see for your programs? We'll give it another minute or so. Okay, student rationale for not practicing safe sex practices, youth perspective on program. How many adolescents in our community lack access to confidential health care? That's a really important question. Anything else? Access to culturally competent services in our community, community support for the program, it's key. More qualitative data. I'd love to do a photo voice project with PrEP participants. That would be so cool. Okay, 30 more seconds or so to see if there's anything else we want to add. More data connected to services. Oh, let me see. More data connecting services to health outcomes. Yes. I think there are often times that data and like for a program and then the actual outcomes that you're seeking aren't necessarily connected, and a way to actually make those evaluations and see that connection is really helpful in evaluating programs. Okay. Anything in the chat? I don't think so. Justine, you want to go to the last one?
Yep.
Okay. So in thinking about these questions and the additional data that you all shared, what resources or capacity would you need to collect and to use for this additional data? Again, some of this might be like wishful thinking, but sometimes I find being able to think about it and what I would want in a perfect world can help me make a plan to get there. So yeah, more time. I hear that. Community partnerships. Access to adolescent populations can we get in at the school level? Partnerships, funding for focus groups, photo voice, and other youth perspective gathering. More training, knowledge, and data understanding. These are all excellent responses. Staff and time. Parent engagement, support of programs. I also want to explicitly name, thinking about these in the context of a global pandemic, also feels like another hurdle to think about too, so. Okay, last 30 seconds. Incorporating youth voice in assessing what data to collect and how to collect it. I love that one. Okay, we have a comment in the chat. Specific ways to track progress. I think that's great.
I'll add that one in here.
Thanks, Justine. Yeah, if there's anyone who's having any technical issues with the Jamboard, you can just message me or Justine and we can add them too. Also, you all, now that you have access to this link, will have access to this Jamboard if you want to revisit it, because it is a publicly accessible board. Any last thoughts or ideas?
I think if it seems like we don't have any more comments, we'll transition back to the PowerPoint and we'll talk a little bit about what was mentioned, or how to use it as we kind of move through. So actually I'll keep on this slide for a minute. So the five kind of questions in the Jamboard, they should also be in a handout that you all have access to. And our hope is that you can use that handout. I mean, it's a very simple handout, but it just has those 5 questions and you have access to the Jamboard to kind of go back to think about what you put in there versus what other agencies put in there. And in addition to those questions, there's some other kind of prompts that I will go through now. We won't kind of answer them in the same way, but just to start thinking about the data that you have, how you use it, how else you may want to use it, and what you need to kind of get there. And then there's some more prompts to kind of get through, which we won't go through now, but just about generating interest. So in terms of using data to craft a message. So you may have like your pre and post data, you may have your service data, you may think I have all this great pre and post data, but I also want to get data on youth experience in the program. But thinking about the data that you have and the data that you want to collect and using it to craft a message. There are 4 questions here that we have found really useful in thinking about how to use data and what you want to do with data. The first is who. So who are the stakeholders you want to share your message with? This could be other community partners because you want to build a larger database or you want to increase the partners that you work with. It could be government stakeholders to let local officials know about your program and what you're doing. It could be other youth participants to just create more interest in your program. And there's plenty of other stakeholders, funders that I'm probably not thinking of. And then why? Why is this a topic that these stakeholders should care about? Why is this a need? And you should be able to kind of go back to your data and think about what do you have that can answer this why? And then what about this program meets the needs described in the why? So the why is more like, why is this a need? And the what is like, how does this program fulfill that need and, you know, really meet that need? And then how do you deliver your message? So we'll talk a little bit more detail about the how in just a minute. But in the handout, there are also these 4 questions that can act as prompts if you do want to go back and do this exercise or collaborate with other staff in your organization or your supervisor or whoever the program director is to kind of think through some of this. So for the how do you deliver your message? Here are a couple of examples, and this is by no means exhaustive. I'm going to talk about a stakeholder meeting, and then Allison's going to talk about a data walk, conferences, and infographics. So a stakeholder meeting, this could take multiple formats. We have participated in stakeholder meetings that are in person and there's a PowerPoint. There are also stakeholder meetings that are roundtable events where people kind of sit in a table and they shuffle back like to another table, and then they talk about different data points or kind of different questions, and then they kind of all come together in a group. You could do a virtual stakeholder meeting. I've actually seen one of these be completed sometime between March and now, when everything kind of went virtual. So there are, and I'm sure there's plenty of other ways you could hold this meeting. Here is an example of something that the Massachusetts Department of Public Health did, is we had a data placemat, or like a data day, where there were placemats on these placemats with, this obviously is very wordy and everyone has their own copy, and they take a minute or two or 3 or 5 minutes to kind of read it and digest it. And then there are prompts and questions that ask about the data. It does not have to be, if you were doing a data placemat, it doesn't have to have all this text and all of these data points. It could be something very simple that has 1 or 2 data points. And then you could also try and do this virtually and have like a slide or breakout room in Zoom or whatever platform you're using, and then have them, like whoever is in your stakeholder meeting, come back in and discuss it a little bit more. So that's one example for generating interest, and I will pass it on to Allison to talk about a data walk.
So a data walk is one of my favorite ways to show data. It's a visually representative way to engage providers with their own data in a tangible manner, allowing for them to discuss and reflect. So I saw that a lot of you are actually prep providers, which is really cool to see. This is an example of a slide that I used in a data walk with some prep data. And what we did was we blew up some data points like this visually in like big posters and placed them around the room. And similar to a gallery walk, providers can walk around the room and take in this data on their own. We gave them sticky notes so they could write questions and post them around the data. So they can be kind of things that other people could think about as they walked around as well. And then there was opportunities to talk in small groups around the different places around the room where the data was hung up. And then we all came back together and had a big group discussion. And what I really like about a data walk is it really can cater to folks' comfort levels. There are providers who don't want to share in front of a large group and talk and want to talk in a smaller space, they can do that. And if there are providers who are comfortable talking in front of a big group, they can do that too. I'll also get a little bit more later on in the presentation about how I created this slide. Another example is presenting at a conference, kind of like this, or at a poster. This is a picture of me presenting at our federal grantee conference, the FISBE one, if anyone was there. And it's a great way to share best practices and to get some tips and tricks that you can bring on to your organization. So poster presentations are great if you like more one-on-one conversations. It can be kind of crowded in the room, but a way to talk with people on a one-on-one level about data. But then also there's roundtable discussions or keynotes, great ways to practice public speaking and disseminate information to a wider audience. Another example are infographics. So they're a visually appealing way to share data in electronic mediums. They're kind of a snapshot of a program at a time. You can make them colorful. You can make them about a program or about a specific thing happening or an event or something that you want to highlight within a program. You can post them on social media, newsletters, website. Here are 2 examples of infographics that we've made, one about our adolescent state-funded sex education programs, and then one about the impact of COVID on our providers that Justine made. And you can use a lot of free websites and resources out there to be able to create them too. Next slide. Okay, awesome. Best practices for sharing data. So really important thing to think about is what do you want to assess and what do you want to show when you are sharing data? So an example that we used in our data walk was to look for specific inequities that we thought exist or knew it exists to be able to highlight with our providers so they could better serve the communities that they serve. So if anyone wants to add into the chat here, what data do you think that we're looking at in this slide? You can feel free to type pre-post survey data. That is correct. What specifically? If you don't know, that's okay too. And if you feel confident saying it, that's fine. We can talk a little bit more about that too. Mariah, thank you also for the note to SRA, your prep providers in Wisconsin. So I'm not seeing a lot of responses, but okay, we got a feeling confident broken down by race. You are correct, Nancy. So in our prep surveys for fiscal year 19, we had a question that I believe was one of the performance measures. This program helped me to feel more confident myself. And the options were strongly agree, agree, disagree, and strongly disagree. And Nancy, you already pointed out the second thing I was going to say is there other data you see? And what we did was we wanted to represent the strongly agree or the agree responses by race and ethnicity, because grouped all together for all participants, we didn't want to see if maybe there were certain racial or ethnic groups that were experiencing the program differently than others. So is there something here that helped draw your attention to what we were trying to show in this data? You can feel free to put that in the chat. Anything that kind of points you in the direction of what we're trying to say with this bar graph? Your title is your takeaway. Thank you, Emily. So a majority of FY19 prep participants do agree or strongly disagree that prep helped them feel more confident. A great way to succinctly kind of overview what you're trying to say is to putting a title or a header here. Another thing which I underlined was I showed the question so everyone knew what, thank you, Jaquan, exactly, what we were trying to ask in that question, in the survey question, and what we were representing. And then here also, you'll see with the arrow, but the arrow wasn't on the slide, that we are breaking it out by race and ethnic group that we collect in the prep survey questions. And then also the N are the number of youth respondents who identify that way. And that's important to put too, because while a vast majority of the American Indian and Alaska Native respondents said that this program helped them to feel more confident in themselves, it's important to know that were only 38 people in fiscal year 19 that identified as American Indian and Alaska Native compared to 241 Black and Latino. So it's an important way to fully represent the picture of who you're serving and what you're presenting. You go to the next slide, Justine. Okay, so another thing to think about, this was another prep slide that we used in our data walk, is there's multiple ways to present data, and you can use the data to assess specific program goals. We have goals within our prep program to assess learning about birth control choices and learning about preventing STIs. So we have here these like donut graphs or kind of pie charts that show that strongly agree to strongly disagree responses for fiscal year 19, and the N here as well also shows how many people responded. So like was mentioned for the last graph, this one we have a header at top. Prep participants were more likely to strongly agree that the program helped them to learn to prevent STIs than to strongly agree that the program helped them learn how to talk to partners about birth control. And this is important because health educators can use this data to think more about, okay, what do I need to focus on and what should I make sure to hit home when I do my presentations in the classroom for prep. So we have headers, we have the number, making sure that your response options are bolded and easy to read are great ways to visually represent the data.
So I am going to talk for just a few minutes, and then we'll wrap up about quality improvement and using data for quality improvement, as well as data quality. So this right here is an example of performance measures. This may or may not be as applicable to your agency. So for us as the Department of Public Health in Massachusetts, this is a performance measure we used with agencies that we funded. I know many of you are not funding other agencies. Some of you may have some sub-grantees. And so this can be used, this is just an example, but it can be used in different ways. It doesn't have to always be used exactly as I'm presenting it. But performance measures can be used both to measure the quality of programming and of the data submitted. So this performance measure, 85% of participants participate in goal setting. What we did here is we had 6 agencies. To make them anonymous, we gave them colors. So there was green agency, brown, blue, purple, pink, etc. And then we looked at this particular measure in each agency. We did have a benchmark. And so the purpose of this, it not only helped us see which agencies had participants more engaged in the programming and doing some of the services, it also helped us realize that the pink agency was really struggling with data collection and data quality. So when we want to produce a report or something like that, and we kind of get to the end of the fiscal year and we find some of the data is of poor quality, or there's some data points missing, implementing these performance measures at certain intervals across the fiscal year really helped us reduce missing data and improve data quality, as well as identify agencies that needed additional support. And so we shared this data. We shared it as a game or a competition. It went over better than I thought it would. It really increased interaction. There was some competition between the agencies. There was accountability in terms of meeting the performance measures for the program. And so this could be done on an agency level as well. I think you'd have to work it out, you know, how it works in your agency and your agency's kind of culture and environment. But something like using this for looking at data quality, or you know, youth participants that answer, like that you're able to collect the pre and post surveys or something like that across the different educators or facilitators in your agency, or if you have different programs, it's something that could potentially be used and in a way that is not punitive, but is more of like identifying who needs support, or you know, who may need some extra help with data collection, or with some best practices for engaging participants or things like that. So that's another way we've used data in performance measurement and data quality. And finally, the last thing I want to just talk about briefly is using data to inform best practices. So in our state-funded comprehensive sexuality education program, we require the agencies that we work with to cover this. It's a little bit small on the screen, but it's just kind of there for background information, the circles of sexuality. So we require them to cover this module as an add-on to their evidence-based programming that they do. And one of the questions on our post survey is identifying what the 5 circle of sexuality measures are. And so when we got the data from these post surveys and we broke them down by agency, we were able to note that 2 agencies in particular had a much higher percentage of their participants identifying all 5 circle of sexuality measures. And so we were able to use this information to have agency K, which is circle that had the 68% identifying all 5 measures, to have them give a presentation to all of the other agencies on the practices they use, how they incorporate this module, what they do, and then there was a lot of Q&A with some of the other agencies on how they teach that module. So this is something that could also be done if you have individual educators or facilitators at your agency and you want to look at the surveys from their particular groups that they hold, or if there's or if you have sub-grantees, or if you want to just, you know, try and identify some best practices, maybe at certain settings that you're in. So this was also something that we have found to be extremely useful for using data to inform best practices. And that is all we have for our presentation. I think we are finishing with an adequate amount of time for some questions. So thank you so much for your attention, and we would love to invite any questions or comments that you have now. And I am going to stop sharing my screen so that we can all chat a little bit if there are questions.
Thank you very much, Justine and Allison. That was some great information. I know I learned some things. I've been writing notes here. So yes, if you have any questions, please. All right, I'll turn my camera on. If anyone has any questions, please put them in the chat and make sure that it's set to all panelists and attendees so that we can see your questions. I have a few questions to get us started. Let's see. So what are your recommendations for increasing community or agency buy-in around data collection?
I will start with this and then Allison can kind of jump in.
Yeah.
So some of our recommendations for increasing community or agency buy-in. One is to, like I think a lot of you mentioned, using data for grants or partner buy-in or things like that. So something that we have found extremely useful for increasing buy-in is just to display some of the data or share some of the data we already have, even if it's incomplete, to say like, this is the data we have about your program, or this is the data we have about your community. And to kind of get more of this information, we need your help with collecting more of this data. And Allison, do you have anything else to add there?
I agree with what you say. I think the other thing I'd go back to is the role of an infographic in social media. I think you don't need to have something that's really complex and really have that many points of data, but something that gets people's attention and gets people wanting more and can go to you. You'll be surprised about how much just making your program known and being able to draw people in that way, and then have these bigger conversations about what it would take to serve young people more or get more data. It's a really good way to just get people's attention, or to get the community's attention specifically.
Good. I've got a question in the chat. Can you let us know the free websites that can create infographics?
Sure. Not sponsored by the Department of Public Health, but as Allison, my favorites are Canva. I'll put it in the chat, and then PictoChart. PictoChart does have a pay option, but to be honest, I don't use it. I just use the free options, and you can have access to as like a lot of different icons, images, and the second one, the one that I made about the adolescent sexuality education, that infographic I made completely using free PictoChart. So yep, Justine, thank you for putting those in. So
Super.
yeah.
Great. Now, those are great resources. Okay, another question. What are some suggestions for engaging stakeholders to get them to the table to discuss your data or programs?
So I think this can be a difficult process to get stakeholders to the table, because there's often so many programs or so many agencies that are already existing. So one thing is to start small and build personal relationships using existing networks you already have. So rather than just kind of blanket email everyone, maybe start with one or two people or agencies you already are familiar with, and ask them to kind of pass on the message and build a network that way is one suggestion. Another idea is to kind of think outside the box. So reach out broadly to share what your program is and who it serves. So not necessarily reaching out only to health clinics, but reaching out to businesses or other agencies that might be working with the population that you want to reach. So if it's like a youth serving agency that doesn't necessarily work with health or reproductive health, reaching out to even a business that works with youth or employs youth would be a good way to start to engage stakeholders. And finally, just to identify a couple of key points to highlight when you're approaching someone, kind of like an elevator pitch.
Mhm.
The only other thing I'd add is not to underestimate the community networks like Justine was mentioning. You don't need to really go too far to kind of see how kind of like a social network web can grow. So even if you are a community-based organization, you don't have subgrantees, if you do a lot of referrals with an agency and you can organize like a stakeholder meeting or kind of like a roundtable discussion with maybe 2 or 3 organizations where you get key people in a room to kind of brainstorm ideas and you are all bringing something to the table, you can see how broad your network actually is and see how you can be like, hey, we want to engage this person, or this is a population we can't serve. Do you serve this population? And kind of build that way.
Okay, super. All right. Mariah has a question. She wrote, it seems like you provide a lot of good data to your prep and SRE sites and more. Do you have some examples of how the sites have used that data locally?
I have 2 examples I can give. One is one of our prep grantees. This was several years ago. There was a health educator who was very excited about prep and probably continues to be excited about all of the work that he does. And what he did was he did a lot of like in-person, like I mentioned, he had 1 or 2 kind of data points or like he had a little elevator pitch that included some data points about the prep program, and he really went person to person and door to door and tried to get more partners for them to work with. So they have used data that we have been able to share with them, or data from their sites that they have just used themselves to really work on partnership development. I think that's an example of how they've used the data. They've created some like fact sheets and things like that. Most commonly, I think they've used it for partnership development. And just another example of, we had funds from PAF, the Pregnancy Assistance Fund, and the grantees or the sites that we worked with, they were also able to use data from the program also to kind of connect and network with other stakeholders and share the successes of the program and get some additional funding to work with that population.
Mm-hmm. That's super. I actually can share an example from one of our programs that we implement in a small rural county in Indiana. I'm in Indiana. And there's 2 high schools in the county, in the county seat where the program's located. And one high school was very, very resistant or reluctant to implement an evidence-based program. But we showed successfully that the other high school was implementing it for several years without any concerns or issues. And we had some good data to show like increase of intentions, contraception intentions, and the overall teen birth rate went down considerably for the county. So that was also a good thing. And so that, that helped the other high school agree to, well, first pilot to see, with their students, and then they incorporated the program. So yeah, sometimes it's like one person has to do it before another person, or one agency has to do it before another agency feels comfortable, especially in a local community. All right, I think we have time for one more question. And how might we address challenges in sharing data in the current environment due to COVID-19? Very timely question.
That is a very timely question. I think obviously relying on like online platforms and social media or email, or if your agencies have websites, I think that would be where I would start. I think just also really thinking about increasing communication. I think this is something that like I even think about on the state level, but there's so much going on right now that being able to just communicate with your participants, with communities, and just even if you don't have data complete or looking exactly how you like. The fact that you're still trying to engage with folks, even in this environment where we are very isolated, that's something that I would think to start with. But yeah, I mean, there's so many different options with the web, and I think that's another place to start too.
All right. Any other questions? Feel free to put them in the chat. I am posting our session evaluation form in the chat as well, the link to it. Please just take 2 minutes to tell us how we're doing. This is the first time we've done a virtual conference, so your feedback is super, super appreciated. You just have to click on that link. It'll take 2 minutes, but we definitely very much appreciate that. And the link is also on the session tab on your virtual agenda. Super. All right. Okay.
Well, thank you all so much.
And everyone, have a great day.
Thank you, everyone.
Thanks.